All right. Hello, everyone, and welcome back to another County of Santa Clara Live Speaker Series. We're so glad you are here with us once again. Today's section is a special one, as we'll be shining a spotlight of the vital work of custody health services. We will talk about who we are, the career opportunities available, and the powerful impact our team makes in the lives of our community every day. My name is Ray Ha, and I'll be the facilitator for today's event. I'm a recruiter with the Employee Services Agency in Human Resources Department, and it is an honor for me to introduce you to this work and the people behind it. Before we dive in, just a couple of quick housekeeping items that I want to cover. This event is being recorded and streamed live on LinkedIn, Facebook, Instagram, and YouTube. So even if someone can't be here with us right now, they'll still be able to rewatch it at a later time. And a huge thank you to everyone who submitted questions ahead of time. We'll be answering many of them today live. And if you are on Zoom, feel free to continue dropping your questions in the Q&A box anytime, as we have a whole team on the background and ready to respond in real time. And for those watching on LinkedIn, Facebook, Instagram, YouTube, we are not monitoring those platforms live, but you can always reach out to us at deisourcing@esa.scc.gov.org, and we'll make sure to get back to you as soon as possible. I think this is going to be a very inspiring section. And we also made it easier for you to explore custody health services career as we created a QR code and a bit.ly/explore CHS page that will directly get you to our career page. And there you will find all of our job openings in custody health, which including psychiatric technician, PSW, MFT, psychiatrist, the sheriff's correctional deputy, and many more. Even if you don't see anyone right now, you can always sign up for job alerts to receive notifications when new openings are posted. And for those who just joined us, welcome again. Without further ado, let's get today's event started. We are honored to have with us today Dr. Jennifer Cole, our nursing executive for Custody Health Services, Linda Sue Rodriguez, our custody health behavioral operations, and Antionette Bonner, our program manager 3 at Custody Health. They'll be sharing their expertise, stories, and advice with us today. So Jennifer, could you please introduce yourself and share a bit about your background and your role in custody health services?
Sure. Thank you, Ray. And thank you, everyone, for taking time to join us today. My name is Dr. Jennifer Cole. I've been with the county for just 1 year. I've spent 30 years in healthcare, majority in acute care settings. And then during COVID, I went to the state of California and started my correctional health experience. So that's been about 4 years now. And we oversee 4 campuses here in Santa Clara County, and we'll get into more of that later. But I'll pass it on to Linda Rodriguez now for her introduction.
Thank you, Dr. Cole. So hello, everyone. My name is Linda Rodriguez, and thank you all for joining us today. I am the Director of Custody Behavioral Health Operations and Service Delivery. I've been with the county for about 18 years now, and I've been with Custody Health Services specifically for about 10. I've had a really unique experience and able to kind of progress my career while I've been with Custody Health. I started as a clinician on the floor and kind of moved through all the different opportunities that we have here, all the way up until now I am in a leadership role. We're really excited to share more about our programs and what we have to offer and the opportunities here. But I'm going to go ahead and pass us on to Antoinette so she can introduce herself.
Hi, thank you, Linda. So my name is Antionette Bonner. I am a program manager 3 here at Custody Health Services, and I've served the county for over 11 and a half years. Over that time, I've had the privilege of working alongside some of the most dedicated professionals in custody health services, supporting incarcerated individuals with complex mental health needs and helping them move towards stability, healing, and reintegration. Thank you.
All right, thank you for the introduction, everyone. We are so proud and excited to have all of you here with us today. Please continue to drop your questions in the Q&A so our staff can respond or follow up with some helpful resources. Dr. Cole, many people are curious about what Custody Health Services does. Could you tell us briefly about the CHS overview, the scope of the services, and the type of clients you serve?
Sure. So Custody Health Services have been around for quite some time, and we recently have grown with new positions added in the last few years. So we have, as I mentioned, 4 campuses. I'm the nurse executive over 4 campuses. At our main jail downtown, our patient population is about 800. In that, we have an intake area where our patients come in and we do a quick assessment to see how they're doing, if they're stable. So really, it's like a triage area. And then from there, they can go into regular housing. We also have an infirmary unit, which is like a med surge, and an acute psychiatric unit, all at the main jail. And our other campuses, Elmwood, we have about 2,000 patients there, and that's where our female patients are housed, about 500. And the majority of the population we serve have mental illness or substance abuse issues. And so it's really important for nurses to have a heart and passion for that. I think each nurse tend to be drawn to certain things they like to do, and maybe as they go on in their careers, it changes. Some people love pediatrics and OB and things like that. Mine, it's never been that way. So I preferred acute care, and then I had this opportunity to go into correctional health, and I really enjoy it. So I was to give it a chance. Some concerns people have are just fear of the unknown. Is it safe? And we always talk about, we have great partners with custody, and that is their role to keep us safe so we can do our job and take care of these patients. And so, we need to make sure we're addressing those patients that come in with substance abuse and mental health abuse, and we're taking good care of them, making sure that we're providing care that they would receive on the outside. So for their chronic illnesses as well. And so there's quite a bit of things nurses do day to day. And I think that's a particular question that's coming up. So I'll stop there.
Thank you, Dr. Cole. That kind of gave us a great overview of Custody Health Services and the critical role the team plays in supporting our individuals in the facilities. Now to give us a closer look at our clinical and behavioral team, I'd like to bring in Linda. So could you tell us about your team and what positions are you hiring for?
Yeah, so, we work very closely with the other disciplines in the building. So like Dr. Cole was mentioning, we have a very large medical and nursing contingent that works here. And the mental health is an integral part of the team. And so we oversee the mental health services for the adult population at 2 of the facilities. So that is our main jail campus and our Elmwood campus. We cover a range of services, anything from medication support, therapy, crisis intervention, ongoing case management, discharge planning. The wealth of things that we do for our patients is pretty vast. The positions that we have available are for both associate and licensed level marriage and family therapists, clinical social workers, or professional clinical counselors. So that's kind of our clinician teams that cover a lot of different services in both facilities. We also hire for rehabilitation counselors, recreational therapists. We have several management positions that are available currently, and some of those also include licensed clinical supervisors.
Thank you, Linda, for sharing your experience and highlighting the impact of the team makes in custody health. Alongside our clinical staff, there are also a dedicated operation and support team that keeps everything running behind the scenes. Antionette, could you tell us about your team?
So my team is probably similar to Linda's because we both work for mental health. So my team include crisis clinicians, so associate and licensed professionals. They're trained in de-escalation, suicide risk assessments, and emergency mental health intervention. I also on my team, there are mental health peer support workers and community workers, and these individuals have lived experience, and they're there to offer like hope and empathy and practical guidance to our clients navigating recovery. And then we have rehabilitation counselors. Our rehabilitation counselors are specialists in the field where they go out and they check on clients to make sure that they're stable and they're okay, and connect them with services that they need that come up during the assessments, and then discharge. MUCs and community workers, they work around discharging, so making sure when the client is getting released, they get their medication, make sure they're getting connected with services on the outside, whether it be for jobs, housing, treatment. So that's basically my team.
Thank you, Antionette, for giving us that overview of the team. So we already heard about different roles and services, but I know many candidates are also curious about what it feels like to be part of custody health services. Linda, could you share with us why you enjoy working here?
That's a great question. I think custody often intimidates people. I think there's a lot of stigma and just fear around the unknown. Going into a jail, I think there's this idea that we're working with like all these violent people and it's so dangerous, but in fact, it's not. This is probably the safest place I've ever worked in my mental health career. And for me, it's really a chance to make a real difference. This is an incredibly vulnerable population. They're often underserved. And this is a way for us to make an impact in their lives. And just being able to work with such a great team of people that are really mission driven, collaborative, teamwork is really a vital part of this, and the multidisciplinary aspects. We have everyone in the building. There's medical, there's nursing, there's psychiatry. So it's just a really unique place to work with a really unique population, and it's incredibly rewarding despite the challenges that come with working in this environment.
Thanks, Linda. I agree that safety and support are the big things in custody health, and we will touch a little bit on the second half of this conversation. And for Antionette, same question. What made you join CHS and why you enjoy working here?
So why choose to work here? Because we're serving. I have a desire to serve clients in this population. I've had it since I started college. But people choose to work here because they want to be a consistent presence for the individuals that we serve, who often experience instability, trauma, abandonment. So in this place where routines are rigid and trust is scarce, like showing up every day with empathy and respect can be life-changing for the clients that we serve. I choose to do this because I believe in dignity, that every person, regardless of their past, deserve to be treated with humanity. That simple act of respect can restore someone's sense of self-worth and open doors of healing. I choose to do this because I see the opportunity to interrupt the cycle of harm. Jail isn't just a place of confinement, it's a turning point. Staff help clients build coping skills. Like we help them access mental health care. We prepare them for a safer, more stable life after they are released. I choose to do this because I want to advocate for the underserved. Many of our clients have been failed by the system, education, healthcare, housing, and jail-based professionals often become the first people they truly listen to and connect to with them. They help them connect with services and to have them fight for their needs, to teach them how to advocate for their needs. And finally, I choose it because I want to witness change. Not a dramatic, like Hollywood style change, but I want the quiet kind, like a client choosing to talk instead of lashing out, attending a therapy session, asking for help. These are the moments that matter, and the people who work in the jail know that. So when we ask why people choose this path, the answer is simple. They believe in people, even when the world has stopped believing in them.
Thank you. Thank you, Antionette. And thank you, everyone, for sharing those insights about the work culture. We've now heard from several members of Custody House Services about the roles, the impact, and what it's like to work here. At this point, we like to open it up to you, our audience. Now we are moving to the Q&A section. So folks, please continue submitting your questions so our staff can help address in the background as well. So let's begin with some foundation question for our panel. Linda, I'll start with you. I know that you already talked a little bit about the team and the population, but could you share a little bit more about the inmate population you primarily serve in your area?
Yeah, so we serve a very diverse population. So we have individuals of all ages, 18 and older, different backgrounds, different cultures. Many live with serious mental illness. So, oh gosh, about, what is it, a third, at least half our population have some sort of mental illness, and a portion of those have a serious mental illness. And so that's, schizophrenia, bipolar, depression. We deal with a lot of folks that come in with substance abuse issues, trauma histories, and some are receiving mental health care for their very first time when they're here with us in custody. Services, like I mentioned before, they span from acute psychiatric care, special management units for severely mentally ill, and then general jail population is also served through our mental health team, through just different crisis contacts, routine support services. And our, like Antoinette mentioned, our approach is really grounded in compassion and recovery-oriented care, ensuring dignity, humanity, and meaningful support. Like I said, our diverse population, they come in with a lot of different issues, homeless, summer housed, just different variations of mental illness or co-occurring disorders, medical complaints. A lot of them also have medical issues they're dealing with as well.
Thanks, Linda. I think that's very helpful to understand the patient population that you are working with. Now let's turn to Dr. Cole. One of the most common questions that we receive is about the day-to-day experience. So what is it like for our nurses working in custody house services?
Sure. So day to day, we have different levels of nurses. We have our registered nurses and licensed vocational and licensed psychiatric technicians, as well as medical assistants and healthcare service assistants. And so variety of support staff to help the nursing team along. So it depends on the area that the nurse is working in. But we do provide 24/7 nursing care. And so we'd say the knock shift would be emergency response. So we are located in an urban area. So we do that basic life supports, first aid until the ambulance comes, which thankfully it's only about 10 or 15 minutes, but we focus on making sure we're doing our basic BLS. And so that's an important function of all shifts, particularly at night. That's the focus. And then chronic care is another area that nurses assist in. So as Linda mentioned, sometimes this is the first time patients have received care and maybe they're just finding out they're diabetic. And so it's really meaningful to make such a difference in someone's life, to help them with their health care and educate them. And so that'll be chronic care. We support our physicians and making sure they're receiving their appointments and medications timely, provide lots of patient education and reinforcement of education along the way. And then we also have specialized nurses. As I mentioned, our intake area, when patients first come in, that's kind of like our emergency room where we determine the patient's stable to be admitted to us or if they need to go to the emergency room. So it's very important that nurses have triaging skills in that area. And then, as I mentioned, infirmary is like our med surge. And so that's kind of day to day. We have similar to the inpatient setting ratios, and they may be receiving wound care, IV antibiotics, things like that, while they're staying on our infirmary unit. And then we have our licensed nurses who do the majority of medication pass. We also have a program where our patients who are able, they keep their medications on person. It's called KOP. So if they're taking their blood pressure medication daily, they can go ahead and manage that on their own. The other medications are administered by the nurse and throughout the different shifts. And then also we have sick call. So that's where the patient places, we call a sick card, requesting for services, whether it's a sore throat or some issue like that. The nurse will follow up with the patient. We have a number of standardized procedures the nurses follow. These are SPs that are approved by our medical staff. And so it could be for things that are over the counter, like treating a common cold or a backache, things like that. So there's quite a few SP standardized procedures the nurses can use to manage those lower level, over the counter medications. And then for other things, we consult with our physicians. We either provide an appointment to see a provider, nurse practitioner or a physician, or we give them a call. They're available 24/7. And that's quite a bit. So I'll stop there.
Great. Yes, great insight, Dr. Cole. Thank you for providing such a clear picture of each of the role and the shift. Now, Antionette, let's bring you in here. Could you share like what kind of opportunities that you are currently hiring for your team? I know that you touched base a little bit about different types of opportunities, but some of the folks here wanted to know what are you hiring for your team right now?
Yes, I can, Ray. Thank you. So our current opportunities, so I'm excited that we're expanding our team. So we have a lot of codes. And so we have for licensed clinical supervisors, licensed MFTs, and licensed professional clinical licensed professional clinical counselors. So those are three of our clinical jobs that we're hiring for. So, and within there, like we're looking for people that are skilled, they have rational thinking, they're experiencing crisis care, case management, advocating for our clients. We're looking for licensed clinical supervisors. So we're looking for a leader that can mentor staff, uphold clinical excellence. We're looking for program managers 1 and 2. So strategic thinkers with program oversight and team leadership. Someone that's going to see the big picture and not just the little box. We also hiring for extra help rehabilitation counselors. And yeah, that's it. Thank you.
Yeah, wonderful. Thank you, Antionette. It's kind of inspiring to hear how staff can directly impact our patient outcomes. And Linda, to build on that, what are the requirements in terms of education and experience that you are looking for people to join your team?
Yeah, so for our clinical positions, so the ones that Antoinette talked about, what we consider our clinicians is our marriage and family therapists, licensed clinical social workers, and the licensed professional clinical counselors. So we actually take both levels, licensed and associate level, all of which have to have a master's degree and either be registered. For associates, they must be registered with the California Board of Behavioral Sciences, and those that are licensed need to have an active license in their field. In terms of like experience behind that, I think depending on which position you're applying for, the level or the amount of experience required varies. So obviously for our licensed staff, there's more experience that is required. Whereas for associate level, that's more of an entry level position. And we do hire associate level staff here frequently. But having some experience, like Antoinette mentioned, just working with our client population, not necessarily in correctional settings. We have people that come to us from all different backgrounds, and really it's being able to bring that clinical expertise into the facility. And it really helps to just have a variety of backgrounds coming into the facility, because it just brings more to the table and what we can offer our patients. For our licensed clinical supervisors, those are for licensed clinicians with some experience in supervising others. We really lean on these roles to assist us in training and that clinical oversight. So as I mentioned earlier, we do hire associate level clinicians, and those staff do require clinical supervision. And so we are prepared to provide that level of supervision for all of our associate level staff. And that's, weekly supervision meetings and either individual or group. Let's see. So we also have rehabilitation counselors, and those are like paraprofessional roles. They do not require a master's degree. We do ask for some background in mental health or substance abuse treatments and familiarity with the population, and really being able to work with our patient population. Again, we don't require that everyone must, although it's preferred to have experience in a correctional facility. It's not necessarily a requirement for all of our roles. We also have recreational therapist positions, and these folks come in and they provide really great opportunities for engagement for our population. And what they do is our like structured activities or engagement groups. Some are a bit therapeutic to our severely mentally ill population. And for those folks, I believe it is a bachelor's degree and certification for that role. Let's see, we also have, administrative support where we're really looking for people with strong organizational and communication skills. All of our managers, so program managers 1 and 2, there are specific like requirements within the job application, but specific for our staff here at Custody Health, which is a little bit different, is that we do require that master's degree and licensure as either an LMFT, LCSW, or LPCC. With some supervisory experience, depending on which position you're applying for. The job spec will give specific timeframes of experience that's required for those positions. And then just finally, we do offer both full and part-time opportunities. So we do have some of our clinician, and this is mainly for our clinician positions, we do have some that are part-time and then some that are full. And opportunities are across all of our program areas at this moment. So we have positions available in our acute psychiatric unit. We have some that are available in our special management units. And those are all daytime positions. We also have openings on our crisis team, which serves the entire population of both facilities based on their needs. And that is round the clock. So we have an AM, PM, and NOC shift for those positions.
Excellent. Thank you, Linda. That's really helpful for candidates to get to know the overview of what you're looking for in the experience and the education required. So who want to understand and start thinking about a career with custody health. Thank you again. Antionette, many of our audience here are either students or very new to the field, so they wanted to know about entry-level opportunities and what's available for those just starting out. Do you have any recommendation for them?
Yeah, so for in custody health services, we do have some entry level. So a few would be if they don't have a degree, but they have some experience working with the mental health population or population that have substance abuse problems or issues, would be a mental health peer support worker or a community worker or a rehabilitation counselor. Like all of those are like entry level here at Custody Health Services. And then for people that do have their degree, associate social worker or associate marriage and family therapist would be one of the ones where you would start and you would work on your hours, and we provide clinical hours for clients that are looking to earn their hours. So we provide the supervision for them. So those would be entry level positions. And then from there, you can make your way up, decide to go back to school, all that good stuff. But those are our entry level opportunities at this time.
Thank you. That's
Thank
really
you.
great to know. It really shows how many pathways there are for people to begin their careers. So folks, I know there's a lot of information already, but we are here to help you. Once again, you can send your questions to our inbox or the email deisourcing@esa.sccgov.org. We will try to get back to you with further information. Now, Dr. Ko, many of our audience members already working in the hospital settings. So how can nurses best transition from bedside to working in custody?
Sure. So it's actually a benefit to have had at least a year experience working in the hospital. And that's because of our emergency response and the need to identify patients that are maybe in distress, going through withdrawal, things like that. So we actually prefer a year of experience in a hospital acute care setting before coming to custody. And then with custody, we have a very comprehensive educational onboarding plan. So we've just recently revamped that. And so we are here to make sure that you're successful in your transition, and preceptors, dedicated preceptors as well. So really the difference that is going to be something to get used to is the security part. And so that means making sure that you're always in a safe position when you're in the dorms. So really making sure that you're following instructions from officers at all times and getting used to having to rely on folks to open doors for you and things like that. So as opposed to a hospital, you're pretty much in your own practice, very autonomous. You're able to go to your patients. Here, we have to ask for permission to open doors and things like that. So the security, I think, is the biggest change for a bedside nurse coming into custody. But as we talked about, very safe. We have officers at every corner. They're here to make sure that they maintain safety and security. And so I'm very confident when I go into the custody environment that I can do my job without difficulty.
Really insightful. Thank you, Dr. Ko. It's encouraging to know how transferable hospital skills can be, whether it is the clinical skills, critical thinking, or patient advocacy. I think those are so important to carry over to custody. And Linda, speaking of support, do we offer on-the-job training for new staff?
Yeah, so for the mental health team, we do provide training for all of our staff. This includes a structured onboarding that includes shadowing and support from managers. We also, I mentioned earlier that we really are based on teamwork. So, all of our clinicians are always willing to help support newer staff as they come in and kind of transition to this new way of doing things. Like Dr. Cole mentioned, the security part about having to have doors opened, that is very different. I think normally people are accustomed to their patient coming to them. In this setting, we're going to our patient. And sometimes there's barriers to that. So we really do help people like understand not only what it means to work in the facility and how to, work with all of the different disciplines and really partner with our custody colleagues, but also, just training in general of what mental health looks like in a jail, because it is different. It's just a very unique place. When I first started working here, I came from community mental health and, I was familiar with like suicide prevention and all of that, but it wasn't something that you dealt with on a day to day. Whereas here, we are always vigilant about suicide prevention. So I think that is something that is very different, and that is something that we really impress upon our new staff and make sure that they understand the significance of what suicide prevention means in our setting, along with just identifying other needs, right? So, here we can write 5150s, which is a little bit different than the community. It works a little bit different now in custody in terms of evaluating that. But it is something that we train people to be able to do. So you'd get 5150 certified and be able to evaluate for those types of situations and then refer to the appropriate team for care. So, training is a really big aspect, especially as people are onboarding. There's a lot of training in the onboarding. And we're actually in the process of revamping all of our training and implementing new annual training series for our staff that, are remain employed with us for a long period of time so that support just continues on throughout. We also have opportunities, with our behavioral health partnership. We can attend trainings through them if you want, like, just additional training on, CBT or different techniques or, specialties. There are training opportunities for that. And we're always encouraging professional development.
Fantastic. Thank you, Linda. It's reassuring to know that there are always strong support for new staff everywhere here at the county. That kind of give us a very well-rounded view of mental health services in custody health already. So I wanted to shift it to Antionette a little bit. On a personal note, why are you still passionate about this work and what keeps you motivated?
The clients. I mean, for me, first and foremost, it's the clients, but behind the clients, we have an awesome team, and the teamwork that happens through our multidisciplinary team. Like, our goal, first and foremost, is our clients, and to make sure that they're okay, and to make sure that they're stable, and that's what I've wanted to do since college. It's like I want to help this population, this marginalized population. And so this job gives me that ability to do that. Thank you.
Yeah, thank you for sharing that again, Antionette. So I know that it's inspiring to hear all of the impact and the purpose behind your work. So Dr. Cole, another big question we've received is about patient ratios. Could you speak to that?
Sure. So we don't have specific ratios as they do in the healthcare area. Rather, we have assignments based on workload. And so we take a look at the number of sick cards that we receive per day, per shift, and how many nurses we need to address those within the 24-hour time limit. So that's how we take a look at the workload and how many nurses we allocate per shift. The same goes for medication pass and for our intake area and infirmary as well. So I can say in our infirmary, we have about 10 patients. I want to say it's staffed just like a med surge. We have 5 patients to 1 nurse. In our APU, it's a little different, acute psychiatric unit. It's about a 1 to 6 is our goal for ratios. And we also have charge nurses and administrative nurses as well. So those report up to our nurse managers. So lots of support, supervisory, and we try and stay within those ratios at all times. Night shift is a little bit lower of a ratio because that's really intended for emergency response if the patients are in general population.
Excellent. Thank you, Dr. Cole. That's very reassuring to hear that. These are all great questions that we have received. I really enjoy the interaction with all of you here. So folks, please continue sending your question along the way. Here's another one, Linda. Many students and new professionals want to know, are there any internship or volunteer opportunities?
So unfortunately, at this time, we don't have internship or volunteer opportunities available. We hope to launch an internship program in the future. We're just not prepared to do that now. But what we do have, and I think Antionette kind of touched on it, we do have extra help positions for clinicians, rehab counselors, and recreational therapists. And these roles help provide that hands-on experience and can be a stepping stone into a more permanent position with us.
And for candidates ready to apply, how can someone get in to work with your team?
Well, the best way is to apply through the county's employment website. Applications are reviewed and followed up with interviews. There's the hiring process to it. For our extra help positions, if you reach out to us, it's similar, the same. You still have to qualify. Your applications still need to be reviewed. There's still interview. All of that still happens. But sometimes, if you reach out with interest for some of our extra help positions, we can help guide you through that process to get you into the facility. But really, I really encourage people just to apply. Sometimes I think it can feel daunting to try to get into the county. There's this website and all these steps that you have to go through. But I really encourage people to just keep applying. Even when I first started with the county, I didn't get it my first time around, right? But once you kind of get in, there's also a lot of flexibility once you're a county employee to transition to other departments. But it's really just that first step of getting through the door and just really, being dedicated to securing one of those positions.
Perfect. Thank you, Linda. That's a very clear guidance for anyone interested in joining. Antionette, I'm gonna turn it back to you. What personality traits do you find most important for success in these roles?
So in these roles, some of the personality traits that would thrive in this role would be emotional resilience. So the ability to stay grounded in chaos. Empathy with boundaries. So compassion without over-identifying with the people that we serve. Adaptability, the flexibility in an unpredictable work environment, because here it is an unpredictable work environment. Assertiveness, so confidence to advocate for our clients and also advocate for themselves at times. Cultural humility, respect for diverse backgrounds and experiences. Team orientation, like the willingness to collaborate across disciplines, and then active listening. So picking up on verbal and nonverbal cues for us when we're going out to assess our clients is a big thing. Critical thinking, assessing complex situations and adapting to it with different types of interventions. Open-mindedness, so working with a diverse population without judgment. Patience and perseverance. So progress can be slow and non-linear, but we'll get there. So those are the traits that we look for in our candidates.
Great answer. Thank you, Antionette.
Thank
I
you.
absolutely agree that those qualities really stand out in this environment. And Dr. Cole, what RN opportunities are available right now?
Sure. So RN, I'm looking at it today. I believe there's about 10 throughout the campuses for RNs and 10 for LVNs. So um, as Linda mentioned, if you go through the process of the application and then you get onto an eligibility list, we work from that. Um, so it's not a lot of openings right now. We've really ramped up the last year I've been here filling positions. So we're down to about 20 total for LVNs and RNs. And as I mentioned, we do prefer the 1 year of experience in an acute care setting, and BLS is required. ACLS is not.
Thank you, Dr. Cole. That's wonderful to hear about the breadth of RN opportunities that we have here at Custody. Antionette, let's talk about daily experience for your operations and team. What does a typical day look like as a licensed therapist?
So for a licensed therapist, a typical day would be conducting maybe 6 to 12 brief or extended sessions per day with our clients. And that could be individual. You could be doing a group in a unit. You would be performing suicide risk assessments, crisis intervention. Um, every day we collaborate with custody staff and the medical team for our clients. We document thoroughly for audits and legal compliance. And then we attend interdisciplinary meetings and case reviews. And we also, part of their job would be to prepare clients for reentry with discharge planning. So to stabilize our clients before, to help them stabilize before they get out of jail. So that's well, I guess, and if you're in a special management team, you would be doing treatment plans. You would be meeting with multidisciplinary teams once a week, consulting with our psychiatric nurses and our psychiatrists, and so yeah, that's the day to day.
That I really appreciate that perspective. Thank you.
Thank you.
It's important to understand both the rewards and challenges here. Dr. Cole, since turnover is always a key issue in healthcare, could you share about CHS turnover rates?
Sure. So we don't have a high turnover rate. We do have a lot of folks who have been here for numbers of years and retire out. So those positions open up. I haven't experienced where we've hired new folks and they weren't successful in their roles. So I actually like to calculate the retention rate. So as I mentioned, there's quite a few with 5, 10, 20 years of experience here. And so yes, the turnover rate, we're always working on making sure everyone's successful. If they want to be here with us in custody health, we want them to be successful. And so we do everything we can to make sure and support them in their journey as they transition to custody health.
Thank you, Dr. Cole. That's very encouraging and significant for anyone considering a role here. Antionette, so we already talked about it. Safety is a top concern. So how do you ensure safety of staff working in these environments?
So how we ensure, so we have training. So we have de-escalation trainings that we provide. So staff, which teach staff how to recognize and respond to psychiatric crisis calmly. We have PROACT training. That's another training that helps with learning how to de-escalate our clients and help them become stable. The environmental design, so we have our secure interview rooms. A lot of our interview rooms, the majority have like a clear sight line to our deputies. We have a team-based response, so our mental health staff work closely with the custody officers during high-risk interactions. And then we have clear protocol. So we have structured intake assessments and suicide risk screenings, which help prevent emergencies. But overall, when they come in and they do their one-to-one training, they're program managers that are training them. And sometimes when they're shadowing clinicians, they touch base on safety, how to remain safe, like where to stand and what to do. So we're always cognizant of, we encourage our staff to always be cognizant of their environment and where they're at. So safety here, yeah, you will feel safe, and our custody partners, they make sure that our staff are safe.
Thank you, Antionette. That's a very real and honest perspective, and I think it's great to hear how safety is prioritized here. Dr. Cole, last question, and another very important topic is funding. So how has custody health service managed budget reductions while continue to provide the care for our patients?
So we haven't been affected enormously by the budget reduction. We've been asked to be more efficient with the resources we have. We understand that if we're able to take a look at our current operations and perhaps instead of having RNs pass medications, we could have LVNs and using everyone to the highest of their licensure, that we can provide a savings opportunity, and every dollar that we can save goes back into the county for other programs, for mental health, for the hospitals and others. So we're all being asked to look at our finances and if we're being efficient with the resources we have.
Excellent. Thank you, Dr. Cole. Once again, it's reassuring to know that patient care remains the top priority. And finally, before we close, I just wanted to ask the last question, like, how does the County of Santa Clara recognize, value, and uphold equal opportunities? Dr. Cole?
Yes, so the county has a department called the Equal Opportunity Division, that their goal is to have the county reflect a diverse, inclusive, and harmonious environment for where each employee is valued. So I'd encourage anyone that's interested in learning more about that to go to the website for County of Santa Clara Equal Opportunity Division. Thank you.
Thank you, Dr. Cole. And thank you to all our panelists. This has been an incredible, valuable conversation, and we truly appreciate the time, expertise, and insight that you share with our audience today. Your perspective really helped shine a light on the important work that's happening every day in custody health and really inspire those who are considering this field. So since we have like 8 minutes, I want to talk real quick about the HR process explanation so our candidates can have a clearer picture how to apply for our positions. So first, you can apply online. All candidates begin by submitting an application through the County of Santa Clara job website at sccjobs.org. Please be sure your application is complete and highlights your relevant experience. And we have an appeal period of 5 days where candidates can clarify their eligibility or submit additional information in order to be passed to the next step. And we have testing for general recruitment. There may be a written exam to assess relevant skills and knowledge. Some specialized position might have other assessment to score your applications. And then you will be put on a qualified candidate list. Candidates who meet the minimum qualification and perform well on testing are placed on a qualified candidate list. We call it eligible list. And this list will be used for hiring managers to select candidates for interviews. And when it comes to interview, qualified candidates are invited to interview with the department. The interviews may include scenario-based question or discussion of your current experience. And last thing is the background live scan fingerprinting. Once a conditional offer is extended, candidates will undergo a background check and live scan fingerprinting. This process typically takes 4 to 8 weeks to complete. And this process ensures that we select qualified, capable, and trustworthy candidates while maintaining the highest standard for patient care and safety. So it's a great idea to prepare for each step, especially for the interview and background process. I just have a quick special personal story that I want to share with all of the panelists and the audience. As a recruiter, I recently had an opportunity to visit both the County Mangel and the Elmwood Correctional Facility. Walking through these sites really give me a new appreciation for the work that our staff does every single day. As I got to see the firsthand of our medical teams who are providing care in an environment that's unlike anywhere else, like supporting patients who often have urgent needs, limited access to care, or really complex health challenges. What struck me the most was how passionate the staff were, not just about the medicine, but about making a difference for the people who are often overlooked. So it really made me realize that these aren't just jobs, they are opportunities that have a significant impact in public service to bring both compassion and skill to a population that truly needs it. And seeing the teamwork, the professionalism, the dedication in action was really inspiring. So I'm really excited and thrilled that we get to highlight the work that we do today. Thank you again for joining us today. Custody Health really offer a unique and rewarding career path for healthcare, mental health, and operations for professionals who want to make a difference in a challenging but highly impactful environment. So we hope that you'll explore our job openings by scanning the QR code. It's been an honor to host this section, and we look forward to seeing you in the next live speaker series. Our panelists, do you have any other closing statement for our audience?
Yeah, well said, Ray. So I just wanted to end with, in nursing school, they teach us about when we take care of patients, we think of them as taking care of a relative. And it's not so far-fetched, even in this setting. And that's because I think each of us can think of a relative or a friend or family who has struggled with drugs and alcohol or mental health issues. And so just bringing that back, and these are our neighbors, these are our community members, and we want the best outcomes for them. So it's just really important work, and I invite anyone who thinks they may be interested to give it a chance. Thank you.
Yeah, so I just wanted to say, I want to reiterate why I love what I do and why my colleagues love what they do. So we're here because we believe in second chances. Working with this population is deeply meaningful. Every breakthrough, every moment of trust, every step towards healing reminds me and my colleagues why we choose this path. The people we serve are often overlooked, but they deserve care, dignity, and an opportunity to grow. So if you're committed to justice-informed care and want to make a difference, we'd love to meet you. And then if I could leave with advice for new team members is to trust the process. This work takes time, healing isn't linear, and neither is learning. Lean into your team. You're never alone. Collaboration is our superpower. Stay curious. Knowledge will come, but humility and openness will take you further. And then protect your energy. Self-care isn't optional. It's essential in this field. Thank you.
And I guess I'll just close with that. I hope today's discussion has really given you all a sense of the impact you can have here and the many ways you can build a fulfilling career with us. If anything that we've said today resonates with you, we really do encourage you to apply through the county's employment website or reach out for more information. We would love to welcome you to our team and have you join us in the important mission that we have here. And thank you again for your time today.
Thank you, everyone. And if you have further questions, folks, please continue to reach out to us after the event. Our inbox is deisourcing@esa.scgov.org, and we look forward to talking to you in person as well. Thank you.
Thank you.